Hi guys, I'm Mahendran from BPT 3rd year National College of Physiotherapy, which is in Coimbatore. Okay, now I'm here to share the few articles about hemorrhage. What is hemorrhage? Hemorrhage is bleeding. Bleeding, also called as hemorrhage, is the name used to describe blood loss. It can refer to blood loss inside the body called internal bleeding, or to blood loss outside of the body called external bleeding. Blood loss can occur in almost any area of the body. Internal bleeding occurs when blood leaks out through a damaged blood vessels or organ. External bleeding happens when blood exits through a break in the skin. Bleeding is common symptoms. A variety of incidents or conditions can cause bleeding. Possible causes including bleeding is a common symptoms. A variety of incidents or conditions can cause bleeding. Possible cause include traumatic bleed. An injury can cause traumatic bleeding. Traumatic injuries varies in the severity. Common types of traumatic injury include abrasions that don't penetrate too far below the skin, hematoma, lacerations, puncture wounds, crushing injury, gunshot wound, medical condition. There are also some medical conditions that can cause bleeding. Bleeding due to medical condition is less common than traumatic bleeding. Conditions that can cause bleeding include hemophilia, leukemia, liver diseases, menorrhagia, thrombocytopenia, von Willebrand disease, vitamin K deficiency, brain traumatic, colon diverticulosis, lung cancer, acute medicines. Some medicines and certain treatment can increase chances of bleeding. Or even a cause bleeding, your doctor will warn you about them when they first prescribe the therapy, and they will tell what to bleeding if occurs. Medications that may be responsible for bleeding include blood thinners, antibiotics, radiation therapy, aspirins, and other NSAID. When the bleeding is a sign of an emergency, if bleeding is severe, seek help immediately. You should seek emergency help if you suspect internal bleeding. This can become life threatening. And the major drugs that are helpful for hemorrhage is tranexamic acid, that is called as TXA, is an inexpensive antifibrinolytic drug that promotes blood clotting by preventing blood clots from breaking down. It has been shown to reduce mortality in trauma patients with uncontrolled hemorrhage. Okay, this is a hemorrhage about my article. Thank you for giving me this wonderful opportunity.